The neck flexion test is a test that we'll take a look at in patients with the upper cross syndrome. When we're evaluating this, we're just going to ask the patient who's lying supine on the table to go ahead and lift their head off of the table. Now you'll notice here, you see how the chin juts forward. That's a very common finding in patients with upper cross syndrome. If this shows up, what I'll do is ask the patient, go ahead and relax. This time I'd like you to tuck your chin and then keep that chin tucked while you lift up. And so we'll take a look to see if they can actually lift their head off of the table, keeping the chin tucked. I always have to make sure I don't say tin chuck. That's what I usually do there. And so as we're taking a look at this, that's one of the major characteristics we're looking for. Usually that chin jutting is associated with overactivity of upper trapezius and levator scap with weakness of the deep neck flexors. But in a case where the patient's able to correct it, they obviously have plenty of strength in the deep neck flexors. Their major issue is more of a coordination characteristic. If they're still unable to correct that issue when they get that second trial, it may actually be weakness in those deep neck flexors. But just to be sure that it's not overactivity or tightness of the levator scap and upper trap, what I'll do is go ahead and tuck that chin for them and passively take them through the range of motion to feel if I have that firm end feel restriction on the cervical spine. That gives me a lot of information there. The sternocleidomastoid is definitely something you want to consider as that chin comes forward, particularly if they get any rotation along with this movement. So that would be something that you would take a look at.